Hey, I'm Dr. Dino Pappas. This is a short orthopedic and functional exam for the shoulder and upper extremity for overhead athletes. So we have the patient lying on the table. The first test that we're going to do is NIRS. We're going to internally rotate and pronate the arm, and we're going to bring the arm into the overhead position. This test is usually positive as the arm gets to about 120 degrees of flexion, and they usually say it hurts deep in here, sometimes pain radiating towards the tip of the shoulder. That's NIRS orthopedic test. The next one is Hawkins. With Hawkins, we're going to bring the arm into flexion, a little bit of adduction. Now from this position, we're going to internally rotate the arm. This is compressing this subacromial space right in here. Compression here, and they note pain in this area, maybe towards the tip of the shoulder, is a positive test for pain. The next test is going to be a anterior apprehension test. We have the patient in this position. We push the humeral head a little bit anteriorly, and we externally rotate at 90 degrees. They'll classically show you signs of instability, like they don't want you to get into that position, or they'll report extreme pain, especially in the front of the shoulder. We follow the anterior apprehension maneuver with a relocation maneuver where we translate. We move the humeral head posteriorly. If pain decreases or diminishes with this maneuver, it's typically indicative, a strong sign that they have that anterior stability. However, if you translate the humeral head posteriorly and pain remains, and they say it feels deep in the shoulder, right back here in the back of the shoulder joint, that would indicate an internal impingement. All right, so relocation maneuver. Pain still have it where deep here in the back of the shoulder joint, typically that's an internal impingement. The posterior superior labrum is being impinged in that position. Let's bring this into one other position. This is a clunk grind test. So this is about 120, 130 degrees of abduction. We're going to load. We're going to put pressure through the elbow. And then we're going to internally and externally rotate the arm, looking for grinding, catching, locking, the popping of the shoulder as we grind the labrum right in this position right through here. Or pain that's deep inside here of the shoulder. That's a positive test for the clunk and grind maneuver. Let's get the patient up. We're going to go into speeds test. Thumb is up in this position. They're going to flex. They're going to rotate outward, they're going to supinate, and we're going to resist that. Hold that position right through here. If they note pain, it's typically in the long head of the biceps tendon as it comes into the shoulder. So bicipital tenosynovitis, right? Hold right here, don't let me push. This is speeds test. We bring this across into about 30 degrees of adduction, horizontal adduction. Hold it right here, don't let me push. This is our new baseline. We're bringing the thumb down all the way. This is O'Brien's test. Classically, it's weakness or pain deep in the shoulder right through here. Okay. As you bring the arm, you're creating stress here on the labrum, the superior part of the labrum. This test is positive for weakness or pain for labral pathology. All right. Let's go into some of our rotator cuff tests that we have. This is a full cant test. I'm testing this in the scapular plane, the most stable position of the shoulder joint. Hold it right here. Don't let me push. Let's compare that with the thumbs down right through here. Hold it, don't let me push. Typically, if they have a pretty significant tear of the rotator cuff, both tests will be positive, with the more provocative usually is the thumb down to the floor, as that is an impinging position of the shoulder joint. They usually like test the rotator cuff at 0. Hold it here, don't let me push. Hold it here, don't let me pull. Bring it up to about 45 degrees, don't let me push. Don't let me pull. Same thing now, testing the rotator cuff at 90, don't let me push, don't let me pull. Noticing by virtue of the position where is the most discomfort. Usually the closer down, further down that they are, the least likely to have discomfort. As you work your way up 45 and 90, more provocative the position there could be. All right. Let's go into the elbow now. When we go into the elbow joint, the two major tests in the overhead athlete that we need are testing a UCL, that's this structure right here, and like the valgus overload or the valgus hyperextension test. When you take this from flexion, you extend. As you extend, you're adding a valgus force. This force right here stresses that ulnar collateral ligament. It's typically the laxity and pain located over the ulnar collateral ligament. There are two positives for the test. Combine this with the varus that's working on the lateral collateral ligament. Again, same thing, testing it right through there. Testing for stability, also for pain control. Let's get you up. Let's go ahead and take a look at the functional test. Let's put you up against the wall. Feet up against the wall all the way. Let's get the head and neck into a nice neutral position. Let's set the pelvis down right through here. What I want you to do is I want you to take the arms up into the overhead position. We are checking to see if the thumbs or the hands make it to the overhead position. If not, it typically indicates lat or latissimus tension right through here. Can she control the neck? Does the neck jut out, or does she have good control in this position? Also looking to see the lordosis. If we can flip around here, notice how I can get my hand behind the low back. This right here means she's increased the lordosis to get overhead extension, and she cannot control. She cannot get thoracic extension, which is a big assistance for overhead motion. The last little thing is we roll this guy up. We're looking at the anterior rib cage, and we start to see how these ribs flare on out, and I'm able to get my hand underneath the crease of the rib. This is loss of anterior control. So overhead reach, anterior control, thoracic extension, lumbar lordosis, control of the chin. Can she make it to the vertical plane? Bring the feet off to the wall just a little bit, drop the elbows down. This is the wall angel position right through here. This just indicates tension of the pecs. Is the arm off the wall, the wrist off the wall? Does the arm drift into internal rotation? Tension here of the subscap muscles would be possible. You can also check the anterior core, these muscles right through here, for lumbar and core stability, and this lordosis, this component right here. Notice I can get my hand right behind the back, which is indicative of lack of thoracic extension, a lack of internal abdominal control right through here. 2 tests on the floor. Let's put you on the ground. This is the 4-point rock maneuver, if that's all right, if I can move your hair right there. I want you to go ahead and rock forward and backward. And we're looking to see what happens to the scapula. If the scapula stays flush with the rib cage, or if I'm able to get my hands, as I am right now, underneath the border of the scapula. This is uncontrolled scapular retraction. And when we have this, that means the muscles, namely the inferior trapezius right here and the serratus anterior, are not doing their job in stabilizing the scapula. Go ahead and go laterally, side to side. Again, we start to see this winging pattern develop where I can get my hand underneath the crest of that. That's uncontrolled retraction. As you can see, when we see this rhomboid muscle is working a little bit too much to pull that into retraction. The serratus anterior and inferior trap are not doing its job. Last thing, drop the knees back just a little bit and go into a modified push-up position. Again, looking at the shoulder blade muscles right through here. Go ahead. And we start to see this pattern where, again, these retract quite a bit as they get right down here and never fully go flush. I'm Dr. Dino Pappas, and that's the Overhead Athlete Exam.